Welcome to this Edison TV interview for the 2020 virtual EKF. My name is John Priestner and I'm an Associate Analyst in the European Healthcare team at Edison. Today I'm joined by Dr. Ben Lips, CEO of MagForce. Welcome, Ben.
Thank you. Thank you for allowing us to be on your program.
Yeah, it's great to have you with us today. Can you give an overview of MagForce and the NanoTherm technology?
Yes, MagForce NanoTherm therapy is a unique tumor treatment for focal treatment of solid tumors. Our NanoTherm therapy system has three components which were invented, further developed, patented, and are produced by MagForce. The first component is the NanoTherm itself, which is the heart of the therapy. It contains basically about 17 quadrillion iron oxide nanoparticles per cc of material. The nanoparticles are tiny iron oxide particles that are suspended in water and distributed basically uniformly. And they have a diameter of about 15 nanometers. As soon as these are injected in the tumor, they aggregate and remain like an implant in the tissue to be treated. The particles are special. They are super paramagnetic materials which occur in the nano range and thus have the ability to heat the tumor as they are exposed to a alternating magnetic field. The second product is a nanoplan, or basically allows the physician to apply the therapy with optimal planning and optimal results. This software supports the attending physician and is an ideal treatment tool for the physician to use to get basically the desired results. It's a fusion of the images before and after the insertion of the particles by a CT scan. After the CT scan, the physician can determine the treatment temperatures and the appropriate strength of the magnetic field, which will help him to develop the basically the optimal treatment plan. So that's, again, heating from within. Now, the third component which we produce is the nano activator, which is about the size of an MRI machine, and is used to basically excite the particles in the location that they've been applied within the body of the patient. The patient lays on the bed and is exposed to the alternating magnetic field at the desired body location. The magnetic field causes the polarity of the nanotherm particles to basically oscillate at about 100,000 cycles per second, creating heat then within the tumor by the nanoparticles. Now, depending on the therapeutic temperatures reached in the tumor or the individual remaining cancer cells in the resected cavity, the physician has the option to apply this in two ways. One would be totally ablate the cancer cells that are remaining in the external part of the resection, or to go offer a hypothermia, which then would be followed by radiation or chemo, which would greatly enhance those two technologies in terms of killing cancer cells. So it makes it possible then for the neurosurgeon to decide which therapy he would like to apply, and basically then that's the therapy that would be applied to the resected area after the tumor is removed. So it's very useful for them then to basically have this, because the particles remain in the applied area, and there is no heating outside of that area to any degree, so you do not then hurt or destroy any surrounding valuable tissue.
NanoTherm is currently approved in Europe for the treatment of glioblastoma patients. Can you provide an update on the uptake of the treatment and the continued European rollout?
Yes, despite the challenging COVID-19 situation, our commercial team has been able to turn the commercial corner. We have partner clinics that are convinced of our technology and use it with great commitment. We see the trend of increasing treatments is sustainable as more and more patients who often do not have time to spare basically have access to our innovative treatment. In Germany, our next clinic will be the Hooferland Clinic in Mühlhausen, and basically Europe then will offer nanotherm therapy for the treatment in 4 different clinics. In 2020, we see a really significant increase in the number of commercial treatments of glioblastoma, despite the additional challenges of COVID-19 pandemic. I would like to remind you that the global opportunity for treating glioblastoma is approximately 150,000 patients per year. This procedure has a significant global market opportunity of approximately 4 billion euros per year.
NanoTherm is now in the final phase of a registrational study for prostate cancer in the US. Can you discuss the importance of the amended trial protocol, as well as the size of the opportunity you see for NanoTherm in the US?
Thank you. Yes, the treatment results in the current stage of the study in the US with the streamlined protocol show minimal side effects and are tolerated quite well by the patient, similar to those of biopsies. The ablation analysis shows a well-defined ablation and cell death in the area of the nanoparticles deposit, as was observed in previous studies. This is what we expected, but nevertheless are very encouraged as the patients now can be treated much faster with our procedure, and basically they need to come only to our clinic for 1 day treatment and then can return home and after the treatment. So this is a significant advantage considering the COVID-19 pandemic, which continues to basically rage here in the US. We continue to expect to have sufficient data in the 4th quarter of 2020 with this streamlined protocol to show that it has minimum side effects. It continues to have 80% confidence in its effectivity. We need that for our commercial plan, which we plan to basically start towards the end of Q4, and this will then be essentially completed, and we hope to be commercial at mid-2021 with our sites here in the US. Again, this is a significant improvement in terms of treatment of prostate cancer, and over 500,000 patients globally could benefit from this therapy, which leads us to a potential market between $3.5 to $12.5 billion per year. So again, a significant medical contribution by MagForce in the field of treating the solid cancers within the patient.
Can you describe the immediate and any long-term impact of COVID-19 on MagForce?
Yes, in Europe, our expansion activities, including activator installations in Spain and Italy, are with our partner hospitals. Basically, were planned for the second half of 2020, but are delayed until essentially late 2021 due to the enormous challenges in these countries caused by the COVID-19 pandemic and the travel restrictions. We continue to see interest in other European countries, and will proceed with our European rollout in the months to come. With that said, we plan to at least 1 more nanotherm therapy treatment in Germany, which should basically allow us to reach our 2021 objectives of again tripling the number of commercial treatments compared to 2020. The treatment of glioblastoma patients cannot be postponed until the COVID-19 vaccine is available, because it is such an aggressive disease. In the US, particularly in the last few weeks, we have seen the advantage of our structure that we implemented in the US. our prostate cancer patients are treated in our own facilities, which basically our staff is educated on COVID-19 prevention and prevention procedures and protection procedures. This outpatient treatment option clearly allows the patient to come to our facility and have less exposure to the COVID-19. And of course, we cannot work completely detached from the pandemic, but having our own facilities, having a well-trained staff, the patients are very comfortable coming to our facility. And of course, in 2A, it's only a 1 to 1.5 day visit. And so they are comfortable with that. We still expect to complete our first stage of the stage 2 in 2020, and basically start our next and final stage in January of 2021. We really know how to handle the COVID-19 procedure here in the U.S., but there is no question that it does have a potential delaying effect, because we have to test the patients, and if they test positive or have been in an exposed situation, they have to be quarantined for 2 weeks before we can come back and test them and treat them. And that's really what's accounting for about a month delay in our program from where I was in June of 2020.
What are the key catalysts that investors should look out for over the next 12 months?
Yeah, first and foremost, I would like to state clearly that we are currently in a better operational position than ever before in the company's history. The treatment of brain tumor patients in Europe is increasing strongly and sustainably, and then the next points of inflection are the conclusions of further partnerships in European countries, which we are working on as we speak. In the US, we are making good progress in our registration trial. We continue to expect to have sufficient data in the fourth quarter to confirm that our streamlined procedure continues to have minimal side effects for the patients, and to gain the necessary 80% confidence that the commercial objectives can be met. The plan is that while we're completing the study, we will begin preparations for the commercialization, which now is expected to begin in the second half of 2021. So all in all, I think we're in the best position that the company has ever been. We have two excellent therapies, and of course the COVID-19 puts some questions in terms of our timings, but we think we have a ways to work around that. In the US and in Europe, we have a situation where the aggressiveness of the glioblastoma insists that the patients get treated and is basically equal to the aggressiveness of a COVID-19. So we have clinics that are continuing to treat patients which need this treatment. So by and large, I think we're on the right track, and we've turned the corner with these therapies. Thank you very much.
Thank you for joining me today, Ben, and we look forward to further updates.